Welcome to our 5 on 5. Please welcome back Dr. Jim Shames, Jackson County Public Health Officer. Good to see you, sir. Thanks for being here.
Good to see you. Thank you.
So we're here today talking about measles. It's something that we've got an outbreak here in the Northwest. Only one case in Oregon, in Multnomah County in the Portland area, but 40 plus over the river in Washington State, Clark County. None here in Southern Oregon at all.
None here in Southern Oregon at all.
Yeah, a lot of rumors last week.
There were.
None at all. Okay,
there
so
were, right.
Who's most at risk for measles?
So anybody who's not immunized, who have not had the actual disease, is at risk for measles. It's extremely contagious. I suppose the question might be who is most likely to get really sick from measles. Pregnant women, those that are too young to get immunized, those who are immunocompromised. Those are the people that we're most worried about, but it's really luck of the draw. Some people can get very, very sick with measles. Okay,
and how dangerous is measles really?
You know, it's not terribly dangerous in the sense that the mortality is relatively low, 1, 2, 3 per thousand, but those are real numbers. There is the risk of neurologic damage, brain damage, hearing loss, but the morbidity, that is the degree of sickness, is pretty high. People get sick. They often run a very high fever for many days running. They're kind of miserable. They might get an ear infection, they might get pneumonia. So most people will survive in this country at this moment in time, but it makes you pretty sick.
Okay, and if anybody's watching here at home and they haven't had the vaccination, does it take long to kind of build up that immune system from the vaccination?
No, it doesn't. In fact, if somebody had exposure and they were unimmunized, if they could get the MMR vaccine within 3 days of exposure, there's a good chance that they'd either get a very mild case or they might not get it at all. So we're talking about a disease with about a 90% chance of getting it if you've been exposed to it. And getting the MMR quickly can reduce that greatly. Obviously, we want people to get immunized as soon as they can, because we don't know when and if that moment of measles arriving in our community is going to happen.
I think maybe that's one of the things that stands out to us in the newsroom as we're talking about this, is that measles can stay in the air for 2 hours after someone leaves, correct? And this has been at Trailblazers games,
right.
PDX,
right.
Some pretty, OMSI, some pretty popular places here in Oregon.
Right. That's all true, although just like most diseases, the closer the proximity, the more likely you are. So if if you're in a waiting room or an exam room or in a classroom with somebody who is incubating measles, then you have a much greater likelihood than if you just kind of walk through the Moda Center.
Sure, gotcha. Good to know. Thanks very much. All right, we're going to take a quick commercial break. Much more in a second. Stay with us. Welcome back to our 5 on 5. Again, we're here with Dr. Jim Shames, Jackson County Public Health Officer. We're talking during the break, preparedness versus panic.
Yes.
This is something you're really focusing on right now.
Right. So we have pockets in our community that are definitely at risk for the spread of measles. So I think measles is a fairly serious disease for many people. It has the potential to be extremely serious for a few, and we are at risk. So we are always practicing preparedness. We're reminding people about what to look for, how to approach their healthcare providers when they think they might have it, but we don't want people to panic. We're not in the middle of a measles outbreak. There are no cases of measles in Southern Oregon, but it's a good idea for us to continually think about the what ifs and be prepared for them.
And certainly with the outbreak going on in Washington State, just over the border from Portland,
yes.
There's obviously a lot of talk about it, as we've been talking about rumors and all of that, and none here in Southern Oregon. Are you guys seeing more people getting vaccinated, or do you even have those numbers available?
I don't have those numbers. There's an awful lot of people talking about it. We are, doing shows like this. We're meeting with healthcare providers to make sure that we've worked out the mechanisms whereby they can keep their patients safe, make sure they have enough vaccine, those sorts of things. So I would like to say to the public that if you are sick or you have a sick child and you think there's a possibility of measles, what we want you to do is call your healthcare provider, let them know what your concern is, and then work out a way in which you can be seen and evaluated without putting a lot of other people at risk. You probably would want to wear a mask when you go in. You might want to be in a special room. if people are prepared that you think you might have measles, they can do an awful lot to prevent the spread while they're trying to, figure out whether or not that's really happening for you or not.
Okay, and if people are interested in getting vaccinations, where should they go? Should they call somebody?
They can call their healthcare provider, they can go to urgent care, they can go to public health. We strongly encourage people to get your MMR. It's a very effective vaccine, and it really has very few side effects.
Okay, thanks for coming in. Good to see you.
Good to see you. Thank you.
Stay with us. We'll be right back.